No, you're good. Because together we are stronger. Individually we are stronger. Remember, every single phone counts. Hello, my friends. Welcome to On Point with Rachel Turgerman. I'm so glad you can join us tonight. My friends, do you know someone that has been diagnosed with a very serious illness? If you do, now's the time for you to recommend them to contact Catholic Palliative Care Services. They offer invaluable emotional support as well as medical support. Joining us tonight is Dr. Tracy Romanello. She's the medical director of Catholic Palliative Care Services and Catholic Hospice. Her services are amazing. She's doing an incredible job at Catholic Health Services. Welcome, Dr. Romanello, to On Point Rachel Turgerman. There aren't any words in my dictionary to thank you for being here with us tonight. I know that you're a very busy person, but I know that you want to educate so many of our viewers and listeners. Why is it that it's so important to know about Catholic Palliative Care Services? How are you?
Thank you, Rachel. Thank you for the nice, warm welcome. Your enthusiasm is contagious. And I'm so thankful to have the opportunity to chat with you about something I'm so incredibly passionate about. So thanks for giving the community a voice on a platform like this. Thank you.
It's a blessing. So tonight, Dr. Romanello, I want to have a vital conversation with you on how you and your team, of course, your executive director, Diane Backoff, Jessica Joseph, your manager for philanthropy, you as the medical director, and your entire team, the essential services that you provide to people that have been diagnosed with very serious illnesses. But before we begin, as you know, I want all of our viewers to get to know you much better. How's that?
Sounds like a good plan. I work with a great team.
Absolutely. So where were you born? Talk to us.
Oh, okay. Well, I almost consider myself a native Floridian. I have lived in Florida for as long as I can remember, but I was actually born in Queens, New York, in Jamaica Hospital. So I have to claim that New York background, even though we moved when I was probably a toddler, and my earliest memories are in Florida, and I've lived here ever since.
Wow, that's awesome. I don't know if you know, but I think some of our viewers do know that I'm also a New Yorker, which is excellent. I love New York people because we're friendly, you know?
Absolutely.
Hey, how are you?
People come through New York it's like the gate to everything else, it feels like.
Exactly. If we meet somebody, we say, hey, how are you? How you feeling today? And I still have my accent. And I'm so happy, Dr. Romanello, that I have not lost it. So congratulations on being a New Yorker. Okay, so what are some of the teachable moments, Dr. Romanello, as you were growing up in New York that perhaps still resonate in your mind that has defined you, if you will? Talk to us.
Yeah, my parents are from Caribbean descent. So my mom and dad were born and raised in Jamaica. So that is very much a part of my cultural identity. I grew up with them always impressing on me, be kind to others. You know, I learned at an early age that material things and having possessions don't mean a lot. Things will come and go in life. And I really credit my parents for giving me the foundation of knowledge and education. Once you have it, it's yours. And they really impressed on me that those two things: be kind, considerate of others, treat others how you want to be treated, and go and learn everything you can and get an education. And I am so thankful and hopefully have translated that to my own children.
That's beautiful. And as we get into the conversation of what exactly is palliative care, my God, once our viewers and our listeners, and I'm saying listeners because a lot of our viewers already know that we're in 12 different podcasts. So you're going to have a lot of people all around the world listening to you on iHeartRadio, Spotify, or Google, or Apple, and the list is extensive.
Your reach is vast. Thanks, Rachel.
Yes, it is. So I like what you mentioned, Dr. Romanello, about that loving and caring attitude. So you are in the perfect, perfect profession. And talking about your profession, which is you're a doctor, you're an MD. What influenced you in your life aside from being good and everything? I'm sure that influenced you. But what triggered you? What influenced you when you went to your parents' house and you said, you know what, mom and dad, I'm going to become a doctor? Talk to us.
Yeah, I think that journey was a little bit different for me. I wasn't one of those people in med school that came out of the womb and knew I wanted to be a doctor. What I did have was a natural curiosity for science. I love dissecting things down and understanding how they work, the function. And there's no more beautiful system to me than the human body. So I always had a love of science. I always had a natural curiosity to understand how things work. And I think I had this desire to understand human behavior.
Very
I, I
important.
I
That's
always had a
everything.
curiosity for why people do what they do and the whole constructs of the environment and genetics, coupled with wanting to understand physiology and anatomy. So I think that early love for science, while I didn't know that would always translate into a medical career, was there's a pathway that makes sense for me.
But everything that you have said, something that sticks in my mind, Dr. Romanello, is the critical skills that you have. So at a very early age, if you're telling us and all our viewers that are watching and our listeners as well, that you were curious, you like to dissect stuff in biology, and that my daughter Rosetta Turgerman loved to dissect too in biology. She ended up being a communications major, but that's interesting. But you have that critical skills mentality as a doctor, and for all those that are watching you right now, Dr. Romanello, that perhaps have an inclination to study medicine, whether it be an MD like you or a nurse practitioner or medical assistant, what would you say about critical skills thinking? How important is it in your profession, doctor?
Very much so. I think that's true of all professions, though. The ability to analyze, take data in, and then come to formulate a plan and action.
But
Critical.
in your case, Dr. Romanello, you have a life or death situation, and you got to have those critical skills, right? The medical people, they need to really
Absolutely.
put it
You
in
have
first gear.
you have to have those critical skills, and you have to be a collaborator, because the medical system is not about one individual. It really is a team effort, and you do have to think and act quickly sometimes. So
Absolutely.
those skills, they do matter.
And you have them. So God bless you.
Thank you.
So that's how you wanted to study medicine. Where did you earn your degree? Tell us.
Yeah, so I am really a product of South Florida. I have been here since middle school, actually. So middle
Cool.
school, high school. I did my bachelor's at Florida Atlantic University. My degree was in psychobiology with an emphasis in neuroscience. So that
Wow.
really propelled me into wanting to study medicine. I actually thought prior to med school that I would or specialize in the field of psychiatry because I was just so drawn to human behavior. I went to med
Mhm.
school at Nova Southeastern University, a beautiful experience. So to all my sharks out there, go Sharks. I'll throw a plug
Give
for
them a shout out,
SU.
Doc. Give them a
Yes,
shout out.
yay. And I had a great medical education there. I stayed in South Florida for residency. I ended up studying family practice, and I went to a rural hospital, and it was the best experience ever for me. I think the beauty of family medicine is that you have such variety there. So you're studying patients of all ages, from pediatrics to geriatrics, but
The
you're
whole
trained
gamut.
the
The whole
whole
gamut.
gamut.
Yeah.
But
I
as a
love it.
family physician, you're trained in labor and delivery and general surgery. So while you don't maybe practice those things because other folks subspecialize in them, you have to
Right.
have bandwidth to understand how all of that plays together and to influence primary care. So that was a great um, I don't know, benchmark for me into the next thing, which was where I subspecialized into hospice and palliative care. And now that I ended here, it was all those other steps, they make sense.
Absolutely. So I know that now you're the medical director of Catholic Hospice and also Catholic Palliative Care Services. Prior to that, where were you working, Dr. Romanello?
Well, I was doing my residency, my internship and residency, and then I had, fate will land us in the right direction. So I did my fellowship training with Catholic Hospice and Catholic Palliative Care, and I had the
Excellent.
privilege to be offered a job there coming out of fellowship. And that's where I've spent most of my medical career, working through Catholic Palliative Care and Catholic Hospice.
Excellent.
And I can't see myself anywhere else.
And we can't either. So Catholic Palliative Care Services, how do they become, into existence? How do they come into existence?
Yeah, well, it's a physician-based practice. It precedes me joining that team. It is an entity under Catholic Health Services. And I think the mission of the bigger picture, the Catholic Health Services, is really to service the community. There's so many arms of the organization, right? So that includes skilled nursing, rehab facilities, educational institutions, hospice, cemeteries. I mean, the span of Catholic Health Services is huge. I think this was one other part of the organization to offer that continuum of care to patients and families who really need those services.
Outstanding. So, you hear these concepts or titles or labels, if you will, Catholic Hospice, Catholic Palliative Care Services interchangeably. Can you try to dissect, talking about that you like to dissect things and concepts, can you dissect those two terminologies, Dr. Romanello? What is the difference between Catholic Hospice, if you will, and Catholic Palliative Care Services? Talk to us.
It's a great question, Rachel, and it's confusing for a lot of folks because sometimes those words are used interchangeably. I think the best way I can describe it is by starting by telling you in what ways they're similar. So both palliative and hospice are about the individual, and it's putting a patient, let's say, at the center core of everything that we do. And that patient, not just them as a person, but who matters most to them. So that could be their caregivers, their loved ones, their family. So they're at the core. Then it's looking at them from a truly holistic way. So not just the medical side of it, but recognizing the psychosocial aspects, the spiritual aspects, the total needs of the person, and then putting an interdisciplinary team in place to support them. And every member of that interdisciplinary team matters, whether that's the nurse, the physician, the chaplain, the priest, the social worker, the pharmacist. Everybody complements each other to offer this total care based on the wishes of the patient and those people who matter most to them.
Well, let me talk to you for a second, Dr. Romanello, because I'm sure our viewers are probably thinking the same thing I'm thinking. I mean, what you're describing to us and to our viewers and to our listeners is that you guys have looked at every single T, you've crossed every single T, and you've dotted every single I, because it's not just like, okay, so you go into the doctor, okay, you get your labs, okay, this is what you have. Now you're looking at their emotional psyche, if you will, correct? And
you're looking at any of that at the door,
Exactly. So what I like about you, from what I seem to understand, is that you are a tremendous support system in the medical field as well, but also you deal with the emotional aspect and everything else that we can think of.
Yeah, I mean, imagine you ask somebody to describe what matters to them. They're not just going to tell you, oh, it's my my health. They're going to say, I'm worried about my responsibility to my children, my financial responsibility. I have this stress. There's the whole gamut, and we hope to close the gaps in all of those areas. When I go back to this, so both hospice and palliative have those goals in mind. Hospice is for patients and families who are facing what we call terminal illness, meaning their prognosis is limited to a 6-month prognosis or less. And then they benefit from that interdisciplinary team support that provides all of those things and medications and equipment and that full interdisciplinary team support. But you do have to have that prognosis of 6 months or less. Sadly, Rachel, I'll tell you, unfortunately, we know hospice is underutilized, and some patients and families only benefit from that service when they have weeks, or sometimes for some, even days and hours. That's the niche to hospice. Where palliative is different is it is for anyone with serious illness at any age and at any stage in that illness. So it doesn't have that constraint of thinking about those last 6 months of life. In all actuality, you want the role of palliative to begin at the diagnosis of illness and then follow the family and patient through the journey of life-prolonging and curative therapy.
I like it. So let me see if I understood it. And in case any of my viewers are watching, which I know they are, and our listeners. So to make the difference, Catholic hospice is when you have a life-limiting illness, correct? That is 6 months or less, versus the palliative care services. There's no time limit. You might have, you have an illness, but they haven't said that you have only between 6 months and less. Now, with the palliative care services, you can still include, Dr. Romanello, and correct me if I'm wrong, the curative aspect of it. So you have both the curative,
absolutely,
and then you have all the emotional support, the clear. I mean, that is amazing. I want to make sure that all our viewers understand this, that if they know anybody, my friends that are out there, anybody that you know, whether in your family or family of friends or colleagues, contact Catholic Palliative Care Services, Catholic Health Services, Catholic Hospice. They are there for you 24/7. Take advantage. Make your life easier because they're about to improve your quality of life. Dr. Romanello, let's take a few seconds break. I want to thank all of our VIP advertisers because without them, this interview would not be possible. We begin with Jose Milton Foundation. Thank you, Ana Vega Milton, President and CEO, for all the altruistic work you do. Thank you for building the new Jose Milton Memorial Hospital, Jackson Memorial Hospital West, for your amazing work with the Red Cross, scholarships for our youth, and the list goes on. Jackson Health Foundation, a big shout out to co-president Charmaine Gatlin, Flavio Giso, and their stellar team for doing an outstanding job in raising funds for the best hospital throughout our nation. Jackson Health System, making miracles every day. Catholic Hospice and Catholic Palliative Care Services. A big shout out to Executive Director Diane Backoff, Medical Director Dr. Tracy Romanello, which is right here in our studios of On Point Rachel Turgeman, and Jessica Joseph, Manager of Philanthropy and Public Relations, and their awesome team. Thank you for preserving comfort and dignity for people that are very ill and their family members. Marie Torreson, CPA, business owners. She will grow your business exponentially with a 360-degree view of your financial and operational performance. Call and make an appointment. Jewish University System, a big shout out to founder Dr. Jorge Alfonso and Lucy Alfonso, President and CEO. Now you can earn your doctoral degrees in education or psychology with religious modifiers. Contact Jewish University System. Also, we have Global Overday Seminary and University, known as GODSU, empowering entrepreneurs to become financially independent to transcend into generational prosperity. Also earn your chaplaincy or cybersecurity certification. Contact GODSU. Meet Alyssa Billiard, your corporate and personal psychologist and psychotherapist to solve your business and personal hurdles. Give her a call and effectuate positive change. New Haiti Enterprises. Investors join New Haiti Enterprises to reconstruct a new Haiti for a better present and a future. A win-win scenario all around. Contact New Haiti Enterprises and make an indelible positive difference. Metro Mommy Agency for all of your pregnancy support before, during, and after. Call Metro Mommy Agency. They provide childbirth education, labor support, doulas, breastfeeding support, night nurses, and the list goes on. With Metro Mommy Agency, you can birth better and begin parenting with confidence. Light of the World Clinic. Thank you, Elaine Maselli Vasquez, brainchild of Light of the World Clinic, for for providing free healthcare services to economically disadvantaged families in Broward County, Florida. Synovus Bank, a big shout out to Armando Trabanco, Regional Retail Manager for Southeast Florida, in business for more than 130 years. Synovus is a financial services company that came from humble beginnings in Georgia. Today, Synovus Bank is committed to supporting our communities in over 300 locations across the Southeast, including our South Florida footprint. Synovus is here for you to safely meet your banking, lending, and investing needs. Hashtag the Bank of Here. For more information about Synovus products, services, and locations, please visit www.synovus.com. United Home Care, big shout out to Carlos Martinez, President and CEO. Another big shout out to Alina Palenzuela, Blanca Ceballos, and the rest of their stellar team. Thank you for keeping our older adults home with excellent healthcare services, because there's no place like home. Now back to you, Dr. Tracy Romanello. Dr. Romanello, as we think of palliative care services, we think of hospital settings. Is there a possibility that we can have the same type of amazing services in the comfort of somebody's home? Tell us.
Absolutely. Ideally, Rachel, that's where you want to be. I mean, think about it. We've all either been a patient in a hospital or visited somebody in the hospital. And when you think about that as an environment, so you're in a hospital gown, potentially separated from somebody else by a drape, with in a very sterile environment, noises and sounds, and an environment that most people are not comfortable with. And then think about having very sensitive conversations about your health and your choices, maybe for serious illness or end of life care, how difficult that is given that environment, right? Now flip that to your own home setting, right? And when the medical team comes into your home and they're now a guest at your dinner table or on your couch,
Right.
I feel like you now have the upper hand in the place that you are potentially more comfortable. Now think about having a conversation about your health or your wishes, or identifying who would speak on your behalf if you were unable to.
Very
those
important.
Conversations and those decisions are so much better at home. So home is ideally where you want to be. And home doesn't necessarily have to be the residence that comes to mind for many of us. That could include an assisted living facility, that could include a nursing home. The home is wherever you consider that to be the place you lay your head. But palliative care, I feel like, definitely has a role in a hospital setting and should guide patients and families who are in that acute care setting, sometimes making very stressful decisions, and it is available there. But it also has a very impactful role at home, where you get to see the environment that influences sometimes people's adherence and compliance with their medications and with the directions of their other doctors. So that lens into the home sometimes is really special and integral. And as somebody who's provided those services at home, I've made wonderful friendships with my patients, visit over visit, because that can't be reproduced sometimes in an office setting or in a hospital.
You were born for this, Dr. Romanello. God bless you.
Thank you. I definitely feel like one of those fortunate people that the pathway led me here, and it seems natural. And I love what I do. And like you mentioned, the team that I work with, Diane and Jessica, and all the leadership I have around me, Wilma and Hyacinth, there's so many people to name, and they all have just tremendous years of experience and feel very passionate and dedicated to the field. And I'm fortunate to be a member of that team, that we all give so much of ourselves, but really love what we do.
Very, very important. How do you pay for Catholic palliative care services, Dr. Romanello? Talk to us about some options, perhaps.
Yeah, the reality, unfortunately, Rachel, is that worldwide, the World Health Organization has identified palliative care as an at-risk. There are many more people who need it than have access to it. That's a global issue. We know in this country we're understaffed with trained providers who are specialists in this very special field. and insurances are trying to catch up with the demand, need, and being a reliable payer source.
So the radar is there. So the radar is there, correct?
So what is there?
The radar.
The attention is, we know that there's a gap. We know the gap needs to be filled. It's identifying enough providers, number one, and then two, making sure that we hold our payer sources responsible for financing it. So we do have great relationships with a number of insurance providers, and anybody who's interested should, I know you're sharing our internet site and our phone number, should call and inquire, but they can also reach out to their insurance provider and ask, is the service covered? How much of it is covered? And then they could always call us and we'll steer them in the right direction.
Outstanding. And for the podcast, the 12 podcasts that we have, can you kindly say the number out loud, Dr. Romanello?
Yeah, so the number for palliative care is 305-351-7086.
Outstanding. Very, very, very good. So services now. Let's get to the services. We know what kind of services do we have for our patients that are very ill, and also for the family members. Tell us.
Yeah, so I mentioned how it's entirely holistic and there's an interdisciplinary team. There are a few key facets to palliative care. One is establishing very clear and realistic goals of care. So understanding what is most important to the patient and the family in their healthcare plan. The other part is enhancing the communication. We know how overwhelming healthcare can be.
Oh my God.
Sometimes a diagnosis. Yeah. Why do I take this medication twice a day? What happens if I skip a dose? There's just a lot to be easily overwhelmed. So part of our role is to ensure that all the questions are answered and that the patient and family feel they have an advocate to the other members of the medical team. And then another key part is symptom management. So we see a lot of conditions where symptoms can be problematic: nausea, vomiting, pain, constipation.
And that can make your life miserable.
So we help to manage those symptoms in coordination with the other members of their existing medical team. And then I have to plug a very important role of palliative care, is making sure that anybody, regardless of their health status, has thought about solid advance directives. So we know the world, is full of change and unpredictability, and everybody should have an advance directive. If God forbid something catastrophic happened to you, that you leave your loved ones who may be making decisions for you, what your wishes would be under certain events. And we guide and educate all of our patients to having a formal living will, advance directives, healthcare proxy, and that's a part of their medical record. So those are all some of the important pieces that palliative care provides.
That's a lot. That's amazing. I know that for Catholic hospice, there's music therapy. Do we also have it for palliative care services patients?
Yeah, so the nice thing about Catholic Health Services is we are a full continuum of care, and it gives me the breath to borrow through our resources and for people to sometimes benefit from different junctures in that care. So music therapy, I have seen how it transforms the dynamic, not just for patients and families, but in our COVID response, we brought our music therapists into hospitals, and when visitors weren't able to get in, we would have somebody playing a guitar or singing, and the staff would sing and dance, and that is such a tremendous gift for everyone. Music is totally transformative.
I love it. I love it. Yeah, and also let's suppose if you have some good memories of some music, maybe perhaps you can tell the music therapist to play that song, and they'll bring some good memories back to their conscious level.
I have seen Alzheimer's patients who are very advanced and maybe minimally verbal, and you play a tune for them, and then all of a sudden you see the light return to their eyes, the shaking of the head, and you can almost envision the era that it brings them back to. Music, we could have a whole session on just music, Rachel.
Absolutely, doctor. What about if I have a pet? doctor. And I really don't feel like getting out of bed right now. And you're giving me my pain management to help my stress. You have the music, but I really don't feel like, getting out of bed, or I don't have the energy, if you will, to get out of bed and walk my dog. Do you have anything in place to help with the pets?
Yeah, we work with our hospice partners. There's a Pet Peace of Mind program that includes volunteers and other resources because pets are like, for some people, they're children. I have a dog and a new puppy, and my life is not complete without them. So I get when people say, I have furry children. So we understand that that is true for many patients and families, and it can be heavy feeling to know if you can't provide for them. So we will always try and investigate what matters most and then guiding people to the right resources. But Catholic Hospice has a beautiful Pet Peace of Mind program, and we will borrow resources from there as we need.
Beautiful. And I know that you love our veterans. Talk to us about our veterans.
Yes, so there is an amazing veterans program. There's so many things that you're mentioning now, and it instantly brings like a patient or a dynamic in mind. So through Catholic Hospice, which I mentioned is for those patients with a prognosis 6 months or less, we have a star-rated veterans program, and it includes a bedside salute to somebody who served in our military. Just wonderful recognition of what they have done for our country. And I think that that bears such beauty for the patient and for the families that we recognize that heroism and gift. So that is a huge program, and it's also managed by veterans within our organization. So when we do that bedside salute, those are other members who have served our country recognizing fellow service members.
I love it. Why do you might feel, Dr. Romanello, that at some point in our lives, obviously we want to live forever, but there's two things we cannot get away from, right? Taxes and end of life, right? And it's the truth. So obviously you're going to make our end of life with Catholic Hospice, but then again, I want to make sure that everybody understands that Catholic Palliative Care Services is not necessarily end of life. It could be that you have an illness, and we're not even looking at the diagnosis of 6 months or less. So you could continue to live for a long, long time.
Yes.
As an expert in the medical field and as an expert in palliative care, and the fact that I want all of viewers to know that you actually train other medical experts to become medical experts in palliative care services. And while I have the floor, I want to commend you, Dr. Romanello, because you have received an award from Aventura Hospital for the Faculty of Teaching. Congratulations. You also have rights at Mercy Hospital. You also have rights at Holy Cross Hospital and a bunch of rehab centers. So you are on top of it. You are right on point. So I want to commend you. I want to commend you for that. But tell us, get right on point with us now and let us have it. Give us the real deal. Why you feel that at some point, all of us are going to need the essential services of Catholic Palliative Care Services. The floor is yours, Doctor.
Thank you, Rachel. I love that you commented on education. It's something that I feel very passionate about. I have the privilege to interact with students and residents and fellows, and it's great. They keep me on my toes too because they're constantly exposed to new research and ideas. So it is a mutual beneficial relationship. Now, the second part of your question, repeat for me after you spoke about education.
Right, because we're talking about palliative care services, and we made the distinction between palliative care services and Catholic hospice. Mm-hmm. And why do you feel that every single person in this universe should be aware of Catholic palliative care services? Talk to us.
Absolutely, Rachel, because you shouldn't have to, and probably you don't want to go it alone. So as I mentioned, medicine can be so overwhelmed. I mean, there's so many systems that feel that way, right? So you think about our education system, our political system, our judicial system, our healthcare system. The amount of data and information out there is almost feels like too much to digest. I would
True.
say you want a partner to walk that journey with you, that understands you, understands what your wishes are, and then helps to digest all of those things in a responsible way and really improves overall quality of life, which is our primary focus. So I would say anybody with serious illness, don't feel like you are alone. You have partners out there. You probably already have an existing strong medical team, and we complement what you already have. And if you don't feel like you have a competent medical team, or maybe the communication is not as much as you would like, or your time is rushed in the office, or you leave the office and you feel like your needs weren't met, that is where palliative plays a significant role. And I think understanding how important it is to provide anticipatory support for family members. There is real stress and caregiver burnout and fatigue. And we do get a lot of calls from family members who say, I feel like I'm at my wit's end. I'm starting to feel the strain of helping my loved one with this illness. What do I do? And I would say, as important as the patient is, and even though they're central to the services we provide, understanding that impact of loved ones and caregiver burnout and providing resources is as important to the success of providing care.
I love it, Dr. Romanello, because you could work with the other doctors, because I don't want people to think that if they go to Catholic Palliative Care Services, gone are their doctors. No, you work in conjunction, in collaboration, jointly.
Absolutely.
With their primary doctors. And that's what's beautiful, holding your hand while you're going through this is so important. All the nurturing, all the love. Well, Dr. Romanello, I want to thank you so much for joining us tonight. We're running out of time. Congratulations on the marvelous and magnificent work that you're providing to everybody that has illnesses that are very serious. Is there a last minute message that you would like to leave all our viewers with tonight?
I feel like I've said a lot, and I thank you so much, Rachel, for the platform, the conversation, and for everything that you're doing for our community. Thank you. I would say, this last year and a half has been incredibly challenging. I mean, who could have predicted a pandemic and all of the changes and sacrifices and unpredictability that we've all faced? I would just encourage your viewers to continue to be kind, continue to be positive. We are here for you, and together we will get through this pandemic.
Amen. Beautifully said. Thank you so much, Dr. Tracy Romanello. Keep up the fantastic work. And thank you for taking time out of your busy calendar to be right here with us on Point with Rachel Turgeman. We love you.
Thank you, Rachel. Thank you.
Thank you, my love. And to all of you, thank you so much for joining us tonight on Point with Rachel Turgeman. Please don't forget to subscribe to my YouTube channel, On Point with Rachel Turgeman. Please share this video with your family and friends. Keeping informed and staying connected allows all of us to make the right decisions. God bless you all. Stay healthy and safe. Bye-bye for now. No, you're good.